Clostridium perfringens is the most common Clostridium among the pathogenic bacteria, causing gas gangrene in clinical practice. Under the microscope, it is arranged singly or in pairs and occasionally in chains, with a size of 1 to 1.5 m 3 to 5 m. It has blunt rounded ends, and its spores are elliptical, located in the center or subterminal of the bacterial cell. After gram staining, it appears purple and is an anaerobic gram-positive course bacillus. On blood agar plates, after incubation at 37 C for 24–48 hours, can form colonies with a diameter of 2–5 mm, which are round, convex, opaque, smooth, grayish-white, and have neat edges. It widely exists in soil, as well as the intestines of animals and humans. It can cause human and animal infections via contaminated feed and water. Therefore, to prevent Clostridium perfringens infection, it needs to destroy the anaerobic environment for its growth, and improve the hygiene and safety of food. Learn more, follow us and visit our website.